Hi, I'm Jay Maddock, the co-director for the Center for Health and Nature, and I'll be talking today about one of our internal research projects titled Developing Health Behavior Change Scales for Health and Nature. Over the last several years, we've seen a variety of books written on the relationship between being in natural environments and improved health. Last Child in the Woods, Your Brain on Nature, and The Nature Fix. We had Florence Williams speak at our last symposium and share a lot of the research. And so we're seeing more and more in popular culture this knowledge of the relationship between being in natural environments and actually improving health and well-being. Unfortunately, what we're not seeing is an actual change in the amount of time that people spend outdoors. This is a survey looking at American adults spending time outside. This is not even in natural environments, just outside. And you can see from this that over half, 56% of Americans spend less than 5 hours a week outside. That's less than an hour a day. And when we get to 10 hours a week, it's the vast majority. So really, we spend most of our times indoors. If we look at the social ecological framework, we have been doing mostly interventions that happen at the social structure policy system, so increasing access to green spaces. Our friends at the Houston Parks Board have been doing an amazing job with the Bayou Greenway project. We've also been doing things at the organizational level, things like Park RX, where physicians are prescribing time in communities. One of the areas that's really been missing is the individual level change, looking at somebody's psychology and reasons they may or may not spend time out in nature. It's kind of the if you build it, they will come, right? And while this worked great for Field of Dreams, it may not work great for people in nature. We can build a great park or increase access to a forest, but if people don't feel that maybe that's the place for them, or they don't really like the heat or the bugs, it might keep them from using that green space. So we need to do individual level behavior change along with the changes that happen at organizations and in the environment. So we look at a theory called social cognitive theory, and this is something that Albert Bandura developed at Stanford University quite a few years ago. And what he said is that really when we look at human behavior, it's brought by cognitive factors, behavioral factors, and environmental factors. The cognitive factors are things like knowledge. I know that it's good for my health to be in nature. Expectations. What do I think is going to happen when I spend time in nature? And your attitude towards being in nature. Along with behavioral factors, things like skills and practice and self-efficacy or confidence. You can think of skills as if you've never been on a hike or camping before, that can be kind of intimidating. And so do people have the skills to do the behavior that we want? And are they confident they can do it? Things like social norms are interesting. Is being in nature for people like me, especially in different diverse communities, they might say, you know what, I don't feel comfortable when I'm in a natural environment. People look at me like I don't belong there, and I don't feel like people like me use the environment. The access in the community we've mentioned, and our ability to change our own environment and influence other people to do that. So in this study, what we're going to be doing is developing social cognitive measures for being in nature. We're going to look at what are the things that derive knowledge and attitudes, expectations, self-efficacy, and social norms, and develop these scales so that we can use them to develop evidence-based interventions to get more people into natural environments. Our method is going to be identifying the domain and generating a whole bunch of questions, making sure that their content is valid and they actually measure what we want them to measure. We're going to pre-test them in a small sample of people and actually do something called a Delphi study, which is experts reviewing them. We'll then do a national sample of 1,200 people where we're going to oversample minority and diverse communities, make sure that we've got really a good look at America. We're going to reduce the items, look at the factor structure of those items, test dimensionality, and then do reliability and validity testing, make sure that we've got the best valid and reliable measures to measure these psychological variables related to health and nature. Once we have these scales developed, then we can develop the evidence-based interventions. And I think that's really going to help us to develop things that are going to get people excited and motivated to be into natural environments. Thank you very much for your time. Appreciate it.